In our line of work, there are many positive experiences, but also a lot of difficulties and challenges. Long hours, long committee meetings, long sessions. So it's appropriate, as we begin this session, to mention a few examples of what we accomplished last year for the people of Washington. To prepare our kids to learn and succeed, we approved the largest expansion of early childhood education in state history, $160 million over the next 2 years. And we enacted the Early Start Act to improve the quality of care and early learning in child care centers. To improve basic education as a path to a better life, we invested $1.3 billion in new funding for K-12 schools. We expanded full-day kindergarten, reduced class sizes in kindergarten through third grade. And we carried out the commitments we made a few years ago with House Bills 2261 and 2776 as part of our paramount duty to our schools. And we provided teachers and public school workers with a wage increase above the cost of living, recognizing the value of their work and helping to catch up after several years without an increase. To help students pursue opportunity, we increased college-bound scholarships. It's a great program. It's an incentive for low-income students to graduate from high school and then attend a public college tuition-free. We also expanded opportunity scholarships for middle-class and low-income students who are earning degrees in high-demand fields with matching contributions from the private sector. To provide health care for all, we expanded Washington Apple Health, which now covers 1.6 million people in the state, including 800,000 kids. We invested over $100 million for improvements in mental health care, providing community-based treatment, more inpatient beds, and better crisis intervention all across the state. We improved important reforms, including Joel's Law, which empowers families when a loved one is in crisis. And we maintained our national leadership role, linking people to health care by continuing the state health care exchange. To strengthen the safety net for people who've fallen on hard times, we increased assistance for families, restored the food assistance program, expanded services and support for children in foster care. And we adopted a home care contract, providing workers with the first in the nation retirement benefit. They care so well for our elderly and people with disabilities. They deserve a decent and secure retirement. To create jobs for a recovering economy, think about this. Our transportation package was the largest state investment in public works in history. It will fix aging infrastructure, increase transit, and create tens of thousands of jobs all over the state over the next decade. In addition, we created jobs by approving the largest capital budget in state history, with increased funding for school construction and projects that strengthen communities all across the state. This House, the House of Representatives, led the way on each of these accomplishments. But our pride in what we accomplish does not give us an excuse to sit back. We need to keep moving forward. Together, we can find practical solutions to meet the next set of challenges. There will be many issues we will tackle: Department of Corrections, state auditor, and court decisions. But for this session, let us focus primarily on the basics. Basic education. We must continue investing in our public schools, not because the Supreme Court says to do that, but because it's our job. This includes working to reform the school employee compensation system and addressing the shortage of teachers. And we must build the classrooms to carry the decision we already made to reduce class sizes. All of these actions will provide hope for a better future through education. Basic health. We should continue our progress towards the simple notion that health care is a fundamental human right. Who among us Who among us would deny care to a child? Who among us would turn our backs on those who are ill or old or disabled? There's no doubt that we have made major progress in extending health care to our people, but we have so much more to do. Even though we enacted mental health parity years ago, we need to stop separating the brain from the body in our funding formulas and health coverage. And we've got to have a heart. It is imperative that we improve mental health care in this state, which suffered so much during the Great Recession. But we need accountability and more resources. We must provide our state and mental hospitals with the staff and the tools to care for those we are committed to help. Basic emergencies. We must help communities devastated across the state by some of the worst fires in history. We should use our rainy day fund to cover the costs of the drought and work to prevent these disasters in the future. But there are other emergencies as well. There are many fires we face. In particular, there are tens of thousands of young people right now that are homeless in our state. That is a moral tragedy. We cannot look away from the fact that many young people are dying from suicide, abuse, and other tragedies. Solving youth homelessness is basic. We need to get them off the street and into a safe home. The same is true for people with mental illness. We can prescribe drugs and treatment, but that is for naught if the person leaves the clinic and is left to spend the night out on the street. So when you add it all up, these three basics are really about having hope, health, and a home. One of the most powerful truths about our America is our capacity to change and improve. There was a time when children went to work instead of school. There was a time when hardworking families had no access to health care. There was a time when people with mental illness faced shame instead of hope. But over time, things changed. If we continue to make progress, there will be a time when we can be proud of our mental health system with parity for all. There will be a time when a doctor can write a prescription for a home as part of a treatment plan for the mental illness. There will be a time when high school graduation rates will be close to 100%, with opportunity for all. And there will be time, and that time must be soon, when we fulfill our paramount duty to the education of our kids. We don't have a lot of time this session, so let's make the most of it. Thank you very much.